Thank you. Good morning. My name's Alexander Salerno. I'm actually an internal medicine doctor for about 22 years in the greater Newark area. November is also Diabetes Awareness Month. And so I'm going to talk a little bit about diabetes. We kind of now in medicine are calling it diabesity because diabetes and obesity kind of go hand in hand. And we're going to touch about that. Um, as a medical student 22 years ago with diabetes, I was able to, as any medical student, learn a lot about diabetes because it does cause a lot of side effects and a lot of what we call comorbidities, basically from head to toe. So I want to kind of talk a little bit about just some facts about diabetes over fiction, talk about the complications of diabetes, and talking about some really great new management for diabetes. Because actually, I like diabetes because as an internist, I usually can only manage disease. But with diabetes and the new drugs that we have, we can actually cure diabetes now, especially type 2. So speaking of diabetes, there are three types. Type 1, you're kind of born with. It's called juvenile diabetes. You're going to be insulin dependent the rest of your life because your body's insulin factory, which is the pancreas, can't make insulin. The good news is that's the small percent of diabetics. Then there's also gestational diabetes. So that's women and pregnancy. So if you had diabetes at any time during your pregnancy, that is usually a crystal ball forecast for us in the healthcare community to say you're probably going to get diabetes later in life. And then there's type 2 diabetes, which is really what we're going to talk about. So, and pre-diabetes. So, type 2 diabetes, just some facts. About 40 million Americans have it. It is the 8th leading cause of death in the United States, but it's the number one global cause of death, diabetes. It costs Americans and America about $300 billion a year between direct and indirect costs associated with diabetes. And if you're diabetic, unfortunately, you're not just a diabetic. You're usually a diabetic with hypertension. You're usually a diabetic with cholesterol, and you're usually a diabetic with CKD, chronic kidney disease. And that's just some of the systems that it could hit. Two really lousy facts about diabetes, like beside what I said, is every 3.5 minutes, a diabetic in America gets an amputation. And it is the leading cause of blindness between 18 and 64 years of age. So, I mean, those are rather devastating disabilities, for lack of better words, blindness and amputation, to say the least. So, as I mentioned, as a medical student, I learned a lot about diabetes from head to toe. In the head, diabetics are at a risk for something called vascular dementia. So everybody heard of Alzheimer's dementia. Vascular dementia is almost as prevalent, common as Alzheimer's dementia, and it's the same end game. You just, you end up becoming demented. Vascular dementia, diabetes, hypertension, smoking are leading causes of vascular dementia. Stroke, diabetics have a 3 times greater risk for stroke. As I move down, in the eyes, we talked about blindness, it's retinopathy, it's increased risk for early onset of cataracts, it's macular degeneration. As we go down further, heart disease, 2 things, heart attacks and atrial fibrillation, 3 to 5 times greater risk when you're a diabetic, even if you're an A student, and we'll talk about grades in diabetes. As we go down further, fatty liver disease. So alcohol hurts the liver, so does fat, and diabetes and diabetics are more prone to fat in the liver. There are 80 million Americans that have fatty liver disease. Fatty liver disease also is curable and reversible, but you need to know you have it in order to do something about it. And just to give you a reference, hepatitis C, only 5 million Americans. So it's definitely more prevalent with the fatty liver in your liver. And then kidney disease, CKD. So you're seeing commercials for UACR, urine for albumin creatinine ratio. It's a test that we're supposed to do every 6 months, real simple. And chronic kidney disease, that's about 40 million Americans. That's about 1 in 10 adults. And the thing is, a lot of folks think, well, I can't have kidney disease because I pee a lot. Actually, you could pee a lot, but it's the quality of your pee when we're dealing with chronic kidney disease. So don't just go by the fact that I have no problems urinating, so I can't have a kidney problem. Further down, peripheral artery disease. That's the amputation thing that I told you about. And neuropathy. You've seen commercials for that too. And if anyone's diabetic in this room and you guys are on your feet all day long, neuropathy and peripheral artery disease is not a good symptom for you guys to be experiencing. On the flip side, there's also prediabetes. So I see a lot of diabetes, but I see a ton more prediabetes. So prediabetes, we just said diabetics, 40 million Americans, prediabetes, 90 million Americans. So, and that's weight and waistline. So, and we diagnose all these conditions with blood works, and it's called A1C, hemoglobin A1C. And that tells us the percent of sugar in your blood. Sugar is not supposed to be in your blood. Sugar is supposed to be in your cells, and sugar is a form of energy. But we measure the sugar in the blood, and it's called A1C, simple test we do. 5.6 to 6.4 is the definition of prediabetes. 6.5 and up is type 2 diabetes. And again, we are supposed to, as physicians, do that every 3 months in a known diabetic. That's how we grade you. 7% is being an A student if you're a diabetic. And again, you could reverse this by your weight and waistline. By the way, like obesity right now in America is getting close to 50% of Americans are considered obese. So bigger is not better. Bigger is sicker. So a little bit about how diabetes works. We have two body parts. We have a pancreas and we have a liver. Pancreas makes insulin, liver makes sugar. So when we're dealing with type 2 diabetes, the problem is that the insulin your pancreas is making is becoming desensitized. How does it become desensitized? Stress can desensitize, obesity, the more fat you have. Look at fat as kind of a sponge that soaks up your body's insulin, not allowing it to go where it needs to go to do what it needs to do. So if you lose the weight, you increase your insulin sensitivity. And it's that balance between insulin from the pancreas and glucose from the liver that we are struggling with type 2 diabetes. So let's see. So when we're talking about right now losing weight with type 2 diabetes, you guys have probably all heard of medicines like Ozempic and Wegovy and semaglutide, which is Ozempic. How do these medicines work and why do we use these medicines? They work by making you lose weight. And by losing weight, you increase your insulin sensitivity. Also, and the other thing that it does, these medicines, they take away your hunger. So your brain realizes you're full faster. So, and losing weight is calorie restriction even more than exercise. So they make you full faster. They increase your insulin sensitivity. They decrease the way your body is processing the food. So it takes longer for the food to be processed when you eat. And longer processing of food makes you less hungry. So the digestive period is going a little bit longer. It is a great drug, the GLP-1s now. This is why I like diabetes, because GLP-1s help us reverse diabetes. You probably hear of people when they go for weight loss surgery, literally within days or weeks, they're no longer diabetic. This is now another option to bariatric surgery, is the GLP-1s. These are typically one shot once a week, and they work really well. They actually help also retrain your body's metabolism. So it's not just, some of these fads, you quit it and you gain the weight back. But with the GLP-1s like Ozempic, it actually changes your body's metabolism and it retargets and retrains your body's metabolism so you metabolize better and you remember that, kind of like muscle memory. Other things too, we talked about like stress. So I know it sounds stupid, but meditation does actually help with stress. Sleep, 7 hours of sleep or more, because lack of sleep also results in insulin sensitivity. And then, what you eat is important too. So, certain foods actually help improve insulin sensitivity. Berries are a big one. So, blueberries, strawberries, raspberries, blackberries, these are not only good antioxidants, but they actually improve your body's abilities to make your insulin work better. Apples, you've heard an apple a day keeps the doctor away. Apples are actually good too. And then like other natural remedies, I'm sure you guys probably hopefully heard of, like cinnamon and apple cider vinegar, turmeric, vitamin D. These are really good holistic approaches to improving your body's own performance when it comes to insulin. So what you put in your body counts, you know. And again, it's that kind of anything you put in your body will turn to glucose, which is sugar. And kind of like what you guys do every day in defending our borders, you really want to make sure, as we enter into this country, we enter properly into this country. We also want sugar to enter properly into our cells from our bloodstream when we eat. And that's what insulin does. It makes sure the sugar enters properly and goes to the cells where we need it, because that's our energy. And that's how it works. So that's kind of like diabetes. I mean, again, it is, a chronic condition, but it is a reversible condition. And it does start with eating clean, losing weight, and some of these great new drugs that we have that not only, make you lose weight, reverse type 2 diabetes. Some of the medicines you probably heard now too, they also protect your kidneys as a secondary benefit, and they also protect your heart. Because again, the number one cause of death in America is heart disease. So more women die from heart disease than breast cancer. Heart disease kills more Americans than cancer. And diabetes, I mentioned earlier, is a 3 times increased risk for heart disease and atrial fibrillation. That's kind of diabetes. So, any questions? Yes. My doctor, I'm type 2 diabetic, but my doctor wanted to put me on Farxiga. That's yeah. Part of that type family? No, so that's a DPP4, which is a new drug, which we like a lot. So that also has made us internists like be able to actually cure problems and prevent problems, not just treat problems and manage problems. So Farxiga, like Jardiance, it also has been shown to protect chronic kidney disease. And it goes out of the scope of the conversation, but heart failure is actually the leading cause of emergency room visits. Jardiance, we give and Farxiga to heart failure patients who aren't even diabetic. So these are wonder drugs, and it does help a little bit with weight loss. Yeah. So Jardiance or Farxiga, along with Ozempic or Monjovi, Monjaro, I should say. Those are really effective 1-2 punch. That probably within 6 months to 12 months, you'll reverse your diabetes. Because on average, I use a lot of the GLP-1s. I have a lot of obesity. My practice is in Newark, so I see a lot of overweight folks. And there are obviously overweight folks everywhere because half of America is overweight. On average, without even dieting with the GLP-1s, people lose about 10 pounds a month. And then we have other drugs like Topamax, which is what we use for migraines. And psychiatrists in the old days used it for depression. We now use Topamax for weight loss. And then there's an old-fashioned drug my parents used to prescribe, which is still actually popular, Phentermine, Adipex. So that's also used for weight loss. Adipex kind of revs your body up, metabolism, puts you into the baby burn mode. So you could be sitting here and actually your body thinks it's on a treadmill. So these are the big classes for weight loss. And again, it's all about weight loss. I mean, bigger is not better, So, yes. What are your feelings on berberine? Yeah, that's one of them too. So berberine is definitely beneficial for insulin sensitivity, and also with that indirectly is the weight loss. So berberine, probiotics, vitamin D, magnesium, turmeric, coumarin, apple cider vinegar, big one. If you do a little bit of that between each meal and before bedtime, it also helps as well. Nighttime cravings too, like dates, handful of nuts, whole wheat cracker with low fat cheese. That's really good. Breakfast, just get some steel cut oats and yogurt, sugar free, plain yogurt. Throw some blueberries on there. That's a very healthy yogurt, very healthy breakfast, I should say, and that actually increases your insulin sensitivity, increases fiber, and that's a great 1-2 punch while having a low glucose burden. Yes, sir.
What are some of the side effects of drugs? Are there any negative side effects that come with this? I've heard something about the Ozempic that it's not only helping weight, but it's also losing a lot of muscle mass.
So my dad would say there's a side effect to even living. So there are side effects to these medicines. The biggest side effects with the GLP-1s is pancreatitis. That's the biggest one. And in laboratory rats, thyroid cancer. What you're talking about, I think, is when you lose all this body weight, right? So, and you lose it drastically and quickly. They talk about Ozempic face. They talk about Ozempic body. It's not so much the muscle mass, but it's actually when you lose the fat, you lose your skin turgor and the collagen, and you start sagging everywhere. So, I mean, muscle mass we lose with age, right? So it's a scale, muscle and fat. So when we're young, it's muscle to fat. When we get older, and as men lose testosterone and women lose estrogen, muscle is down here, and now fat adipose tissues go up here. Sure. Yes, sir.
What age would you recommend, tested diabetes? So diabetes for me, like, runs in my family. So my mom has joked that her doctor tells her, "Feel sorry for your kids because they're highly maybe diagnosed down the road with diabetes." Probably 10 to 15 members of my family, all different stages.
Yeah. I mean, the old saying, apple doesn't fall far from the tree, right? So routinely, we go for now with all insurances, we're supposed to do an annual physical, right? And we have basically algorithms for each age group. But common to all of these is always serology, blood work. So we're definitely with your annual physical doing blood works, and we are screening right then and there for diabetes, looking at the A1C, not your regular blood sugar, because the A1C looks at 3 months. It looks at the big picture. It doesn't look at what happened in the last 12 hours or 24 hours of what you ate or what you drank. And that's how we use to diagnose prediabetes and diabetes. But again, type 2 diabetes is 100% modifiable and curable. So the apple falling from the tree doesn't necessarily mean that you're going to follow the footsteps with the type 2 diabetes. Type 1 is totally different, though.
So as long as I'm doing my yearly physical with my doctor.
Yep. And the blood works that go with it. And look, it's like we called it diabesity, right? So try to keep your BMI like under 30, ideally 27, body mass index. So body mass index and A1C are now becoming interchangeable in medicine, where one kind of influences very much the other and vice versa. So it's the BMI, Yes. So obesity is 30, morbid obesity is 35. We'd like to keep you around 27, So any other questions? All right. Sure. Thank you. Thank you.